see advanced joint space loss, the superior compartment, subchondral cyst formation here and here, subchondral sclerosis. We see marginal osteophytosis, and we also see superior displacement, superior lateral displacement of the femur. That results in increased thickening of the medial cortex, known as buttressing, right down there. By the way, what's the other name for a old bone hip? Malum coxae senilis. Malum coxae senilis. Malum coxae senilis.
What was the last word?
Okay, so here we have a fracture of a ring structure. So remember, you can't fracture just one side of the ring. The trauma requires that there's two sides of the ring that's fractured. So here we have fractured superior inferior pubic ramus, and when you see that, always look at the ESI joints to make sure that they're okay. There's no widening of the ESI joints. Over here we have fracture and dislocation of the symphysis pubis, and what do we see up here? We see a widened SI joints. That's a gagging fracture, battle fracture.
Those are two different.
Okay, this is one you shouldn't miss, right?
What's that?
This is
Slip
a
capital.
slip femoral capital epiphysis. Slip femoral capital epiphysis. So it has the head is stationary and the neck moves out. Also some rotation in there as well. So that's a slip femoral capital epiphysis. So here we have stenosis involving the neuroforamen, and since this is down at the 6-7 level, what nerves would be involved, and where would you test for this? What symptoms would the patient have? So that would be the C7 nerve distribution. So what reflex will we test?
Triceps.
Triceps. And where would you have pain? Middle digit and up the extensor in the arms, right? What do we have here? We have a monoarticular arthritis, and there's joint space loss. There's joint space irregular loss, but in addition to that, there's also these little overhanging edge signs right here. So that is crystals grinding away, but grinding at a slow rate, allowing the bone to try to reform. So that's what the overhanging edges is. So also we see large soft tissue swelling in here. So that is our old lumpy, bumpy joint disease. Gout. And so you have a short, loosened lesion, a short, long bone, short lesion, short, long bone, usually an enchondroma. If you have a long lesion in the long bone, it's usually fibrous dysplasia. So short lesion in the short bone, enchondroma, long lesion, long bone, fibrous dysplasia. Also we see calcifications inside the lesion, and we see intact, slightly expanded cortex. By the way, enchondromas never have periosteal reactions. If there's the periosteal reaction, there's something else wrong. Same thing with the unilateral, unicameral bone cyst and non-ossifying fibroma. So here we have don't get a periosteal reaction. If you see one, it's either not that or there's something else wrong. So here we see somebody has pain in the neck, and there is absence of the C3 spinous process, and so this is most likely lytic mets, and if this is a female, breast, male, prostate or lung. Yeah, kidney.
Yeah, you see this. Hey, what is that? Oh, it's a whole picture.
So this is a person who had a little bike accident.
What are we looking for here?
Huh?
What are we looking for here?
What are you looking for? Fracture.
Sure. I didn't know what it is.
See the fracture? So the AC joint is intact, but it fractured right there. So this is a mid-follicular fracture, usually associated with a fall on the point of the shoulder, such as bicycling. You can do that with skiing too, yeah. Although skiing, you usually flail with your arm. Okay, so we have 5 delicate calcifications involving the menisci. So this is chondrocalcinosis, representative of CPPD. Chondrocalcinosis in CPPD.
Get that every time.
So here we see linear ossification inside the bone, inside the muscle, and what muscle do you think this is in? What muscles run? Look and search right here. Hamstrings. Right? Hamstrings and search right there. So this is somebody who had a hamstring injury. They tore their hamstring. They can get proper therapy, and now they have myositis ossificans. Because it's usually traumatic, we call it myositis ossificans traumatica. Any questions on it?
For us, unfortunately.
Most relevant.
What are your favorites of all of them?
If we know this, yeah, if we know this pretty well, are we going to do well on the exam, or do we need to go and study further information?
I gave you a lot of information. That's for sure.
All right.